gotcha. I gotcha. Oh. Tell me. Did I give you pain down the leg?
A little bit.
A little bit? Okay, face up for me. Tell me.
That's where the pain was at.
Mm-hmm.
But it kind of feels like, I feel like relieved.
Mm-hmm. Mm-hmm. I needed that one. That was stuck in there.
Oh, that was nice.
Oh, yeah.
Oh, jeez.
Right there. That needs to be removed. Like the Frozen song. Let it go. Let it go. How does that feel? Does that make it worse?
No, it's better.
Feels better?
Yeah, it feels better.
It's just like wrapping an ankle. You know, like people that tape their ankles. You know, you're just creating an external ligament. Mm-hmm. So the internal ligament that holds that joint together is torn, and you're putting an external ligament on to try to brace it.
You can feel like a limp, like a liquid lump.
Okay.
And then yeah.
Inflammation there. Mm-hmm.
Mm-hmm.
And that, you said you noticed that when? That was
this summer.
So you've been
when I force my back a lot, when I stay on my feet for a long time. Now even hurts when I cannot sit for longer than 20 minutes.
Okay, and you get pain on that spot?
Yes.
And
so
down the leg?
Yeah. Mm-hmm.
Okay.
Sometimes it drops down way down to my knee, and my leg just goes numb.
Okay. And when you were seeing a chiropractor for that, and what did they tell you was the cause of that?
Oh, just too much work.
Okay. We're going to give you
exhaustion.
Nobody. I'll give you the answer in a second because there's only really one thing that causes that. But nobody was interested in taking a picture. No.
Well, I
MRI?
did. They did an X-ray,
okay.
But it was completely fine.
And because you're 26 and you're not going to see it on an X-ray, it'd be kind of silly to take an X-ray of a 26-year-old. You have to take an MRI to see the soft tissue injury.
Okay.
There's disc involvement. We have disc.
Well, I believe that. I mean, what do I know? But I think that I have a pinched nerve.
Absolutely, yes.
Yeah.
So the disc is hitting it. The nerve comes out on the side here
mm-hmm.
and comes through this little hole called the intervertebral foramen. And as the material, it shouldn't really be touched by anything. And if the disc starts to bulge out, it can, get pressure on that nerve. And that's what gives you then the leg symptoms. Mm-hmm. It's 100% coming from disc mm-hmm. nerve pressure. You're not going to have bone spurs at your age. I mean, somebody might be 50, 60 plus, and the disc will shrink back in over time mm-hmm. because of what we call desiccation. And then the bones will grow. That's with this model. You're too young for this one, but as the spine ages, the disc will kind of like bacon get kind of dried up, and now it's the bone spurs hitting the nerve. My care is primarily centered around moving the stress off that area. So you're pointing to the dimples are right over this mm-hmm. area here, and the nerves that come out of here are going to go right across this region. So. And it's not unlikely that these attachments have been inflamed. This joint's probably tight, which is what contributed to the lumbar discs being injured. So this model has a L3 disc injury, showing pressure on the nerve, but most likely it's at L5 or L4. These two encounter
a little bit down. Mm-hmm.
They encounter about 99% are actually these last two guys. And so they happen for a couple reasons. One, we lose the lordosis, the natural curve that our back should have. This is where, life of school and sitting, and then you work now as a server. Mm-hmm. There's a lot of standing and carrying and being bent forward. And so the curve in our back goes straight, and then like a ladder, all the weight goes right down to the last two guys. And then that ages those discs at a faster rate. Now, even more complicated is that the disc had to have had an injury about 10, 15 years ago from when you felt it. So probably back in your early teenage years, and we'll talk about them in like running, bicycling, or falling, or some sort of injury, mm-hmm. gymnastics that happened, usually a fall on your bottom, mm-hmm. falling out of a tree. You understand, something that happened that that injured the actual end plate. So the disc attaches to this bone here, mm-hmm. and when you compress a healthy spine, the actual bone gets injured, not the disc. The disc then cracks the end plate, that releases acid that then liquefies the disc and then makes it even bulgeable, herniatable. You have to have a prior injury to then have that symptom. You're saying 26, or when did it start? Last year?
Like 25, yeah.
25, 26. So in order to have that, we're looking for the cause is really back as a child level. This is why people come in and go, why are you adjusting that kid? They have symptoms? No, we're being on the preventative healthcare side. So typically I'll find that this area is pretty tight. So this area has to be kind of shut down to allow this to be overstressed to begin with. And then the loss of that curve. So this is what an MRI would show. The MRI shows the disc. And on X-ray, it's just a shadow, right? You don't really get a visualization of the disc. And so when a disc is actually swollen, it'll actually look really good on X-ray. As it's bulging out, the space will look really good. And so then you're left with not a true accurate statement of your spine, right? The X-ray looks good, but yet if you take an MRI of that same spine, you would see that there's actually a disc injury. I caution doctors, especially with that symptom, which we know is coming from a disc injury. It's like, why would you take an X-ray? Because you're just gonna see a really good looking X-ray and not see the validity of what's actually happening, which is you have a disc injury. How much pain is on that spot relative to the leg?
Well, because the month of January I've been resting pretty much, so it's handleable. But if I do stay on my feet for a long time, the pain is so sharp that I can
right over that
stand
spot.
it. Yeah, right over that spot. So I gotta take some painkillers. So
gotcha. So usually the local pain is the joint. It's going to be the knuckle in there, the facet that's giving you pain, and then as that joint disc hit the nerve, you then start getting it. Does it burn? Does it go numb at all?
It goes numb. When it drops down to my knee, the pain just starts from my hip way down to my knee. The leg goes numb.
It'll eventually go down to the foot if we don't get a handle of this. So
I know it's gonna drop down way.
So we got to get a hold of this before it goes. It'll all eventually become, Ed, my toes are going numb. When we inflame the lower neck, that gives you pain on the border of the scapula. So it's really a lower neck overstressing that's giving you embryonically these two areas are connected. And so what's sort of deceiving is sometimes to take stress off the joint, your head will go forward. And now it goes away. And it's gone. Well, didn't really go away, you just avoided. Do you understand? So, now I got the shoulder blade pain, Ed. Oh, it's gone.
It does happen, yeah.
So it'll be...
That's why you try to relax and just...
Right, so your body's going to go into avoidance, and then what happens is when your body goes forward with your head, that amplifies the lower back stress. So they're connected. Does that make sense? That it didn't really go away. Your body dealt with the neck issue that you were dealing with by putting your head forward in compensation, and now that's amplifying the lower back. And so now, and then what'll happen is as I bring your body upright, this will calm down, and your neck start, what the heck's going on here, Ed? Right, because there's dominoes. There's cause and effects here. All right, relax. There we go. All right, shoulders aren't too bad. Head is doing. You're fine. Keep looking straight over me. I'm just analyzing different things here.
No worries.
Hips. Your hips are over to the right. You're fine. Relax your arms. Hips are over to the right. Your torso's. So you got a little bit of this going on. Hips are over to the right. Your body does that again because Ed, you just told me I have lower back problems. So your body's going to go into. It's going to shift things around. So I expect to see some shifting, but I'm just analyzing what I'm seeing here. Hips are that way, torso's going left.
I did had scoliosis before. Yeah, but...
And you're really preferring to stay on the left leg, right? You're really... right?
Well, I think because of the pain, I kind of got used to it. Yeah, because I don't know. I think so. If I put pressure on this leg, it just feels better.
Her left knee is contracted. She got her left knee contracted, and the right kneecap is all relaxed. What we'll find is that there's going to be something on the right side that's making you go away from it, and that's what I'm more curious to find.
That's what I've been told, that if I have the problem from the left side, it's going to affect on the left.
There's a problem over there that you're getting away from. I'll find it in a minute. But there's something over here that's making you go away from it. That's why your hips are going to the right. And
I look funny.
It's okay. I'm not gonna. All I do is look at posture every day.
Yeah.
Okay. I wake up in the morning. I go to bed. I look at posture. Relax your arms. There we go. Yeah. So the head's not too bad. We're only about a ½ inch, really. Ears are looking pretty good. Just real quickly, if you tilt left with your torso or tilt right, is there pain when you tilt your torso to the side? Anything going on?
Well, over here only.
On the left side?
Yes,
when you
but
go both
when
ways?
I go, over this side is fine. My right side is fine.
So
only
tilting,
when I go, I do feel like a pinch over here.
When you tilt to the right and left?
No.
Only when you tilt to the right. You feel it pull on the left.
And lately I've been, well, probably that's the cause of it, but sometimes I feel like on my heel, I feel pain on my heel when I stand straight.
Pain down the leg.
Yeah,
Right.
it goes way down to my heel.
We call that the radicular pain. So the nerve root is giving you that radiating pain down the leg. There we go. Deep breath in. I got you. Let it go. Exhale. Let it go. There we go.
Oh, that was nice.
Oh, yeah. Deep breath in. Head straight. And then exhale. Let it go. Here we go. There you go.
Oh.
Yeah, we need that. You need those.
I definitely needed that.
That middle back being tight is what allows that lower back to be stressed out. And then we're going to discover some of the oldest injuries, most likely in there, and we'll show you at the end how to keep those areas working. Now, have they done this adjustment to you?
Yes.
I'm going to show you a couple little tricks or little things to caution with this. As a patient, sometimes you might not know the answer. I'm going to ask in a second if you do, but when you do this adjustment, you want to be adjusting that SI joint because this area doesn't have surgery. All the surgery happens right where that pain is in the lower back. So when a chiropractor adjusts your lower back, it's not a really good idea to be, does that make sense, adjusting the part that's the most overstressed area. Does that make sense?
Usually when they do this thing to me, they adjust me this way, I feel more pain after that.
Yeah, it's not good. Then we got to be careful because we have, but if they don't know it's an injured disc, then we're shooting blind here. Do you understand? Because they didn't give you an explanation. I asked you, what do they say is causing the pain? Stress and I'm overworking. Okay, so we're not even on the same page of what's happening. Why is that hurting? Because then if you know that, then you know, well, maybe we should stop poking our finger into a wound. You have a wound in your lower back, right? And part of the reason why there's a wound in there is because that area is constantly being stressed out. And so we want to be careful to adjust only the areas around it to not aggravate the injured one. And I'm going to try to show you that right now. Okay. Take a deep breath in and exhale for me. All right, I got you. All right, other side for me. Right, get the idea? How'd that feel?
It felt good. It didn't feel like pressured a lot.
Shouldn't be, you're right, hitting the lower back hard. You gotta be careful with poking the wound, you understand? And the area is injured. Because the lower back is so loose, that's why it's injured. So it's so loose, so it's easy to adjust, right? And that's, in fact, the area that we need to not adjust. We're trying to adjust the sacroiliac joint. If you can, sorry. These joint here, which is this SI joint, without adjusting the little joints in the lower back, right? This joint is a lot stronger than these joints in terms of its work capability, and that's why we're trying to contact that SI joint and loosen this joint here, and that takes stress off these joints. But we want to be careful not taking these. Sometimes you'll see a patient on their side, person's putting their hand on the lower back and trying to manipulate the lower back. We want to adjust above and below. Take a deep breath in. Here we go. Exhale for me. A little closer to me, actually. A little closer. Sorry. There we go. You're fine. There we go. All right, take a deep breath in. Exhale. I got you. I got you. Tell me. Did that give you pain down the leg?
A little bit.
A little bit? Okay, face up for me. Face up. Yeah, this is that joint down there. There we go. Tell me.
That's where the pain was at. But it kind of feels like, I feel like relieved.
I needed that one. That was stuck in there. So that clunk was the SI joint. Now, most of the movement was the SI joint, but a little bit of movement happened at the injured disc. Does that make sense? So we want to focus on not putting any more stress on your lower back. It's an eager member of your team that wants to move. I got you. Relax. There we go. I got your head. There you go. Relax this right. There you go.
That's so good.
Put your back. Go deeper. I'm just going to massage a little bit and then we'll. There we go. I got you. How many hours a week are you working typically?
Well, right now it's less than 20.
Okay.
Yeah, but summertime I work over 40.
Okay.
It's a problem even to have my normal life because I cannot even go out because if I stand on my feet for too long, it just keeps hurting. And I've always been active.
like I was saying earlier, something happened 10, 15 years ago to bring the symptoms that you started feeling a year ago.
I mean, I did fall off a tree because I was climbing a tree as a kid.
I knew it.
Like a lot. So maybe that was the cause of it.
And how old was that? Like,
It was, I was probably like 12.
and you landed on your butt? Where'd you head?
Yes.
Mhm.
On my back, actually. I
Mhm.
fell down straight on my back.
Mhm.
But it wasn't like from a really, it wasn't from a big height.
Mhm. Well, I've had people, like a hammock string break, and a guy just hit the ground 3-4 feet, and it'd be enough to do it. It doesn't have to be like, 20 feet. It can be just, 3 feet,
Yeah.
8 feet is enough
Probably
to.
it was like 2 or 3 feet. It wasn't like really high.
They've actually said when I was in school, they were even just simple as stepping off a curb. Well, let's say you go to step and you don't realize you're going off a curb, and you like plant your foot, but then the ground's like 6 inches lower, and then it catches you off guard. That can do it. I mean, in terms of injuring the end plate, it doesn't have to be this catastrophic thing, but that allows the disc to start to liquefy, and then allow it to be at 25, 26, you've been are having symptoms.
Well, actually, when I first heard my like upper back, it was I was just playing with my nephews, and I was holding one of them, and she was moving and she was gonna fall, and then I just moved like super fast, and something twisted, and I just felt the pain, and it didn't go away ever since.
Yeah, and that was, you said, was it left shoulder blade? Which shoulder blade was it?
It was the left one.
Yeah,
And it
'cause-
just dropped to the left side.
Yeah, her left side, if I noticed when I adjusted you, the left side of your neck it moved really easily. The right side is a lot tighter. And so the left side is your abused side, the right is your stiff side. Like this is actually much softer over here. The top 2 bones up here are supposed to be doing most of the work. They get tight, and we got to get them loosened up and then try to bring you back to what we call the lordosis of the neck. Just like there's supposed to be a lordosis in your lower back, these curves are supposed to take us to 100. All right, I got you. Back over this right side. Kind of more, like I said, more bound up on the right side. Your head likes to tilt left,
I can feel it tighter.
and it's got a little bit of a crunch right there. There. This is what you want to try to have somebody up north identify. Say, I feel like I got a lump right there. Feel that crunch?
Yeah.
That's got to be worked out of there.
It's like the same thing I felt on my lower back. Just from the left side.
Yeah, there's going to be things on the right side that you're avoiding that make you overstress the left. So left shoulder blade, then left lower back. It's all a right injury avoidance. All right, I got you. It's okay. There it is. I got you. Here we go. You okay?
Yeah.
A little deeper. Just trying to get that a little softer. Right there. Yeah. It's like a clog. This has to be, there has to be a congestion somewhere else to allow another area to do double or triple. This is doing half or a third.
That's where the pressure goes on the left side.
That's right. Right. The left is compensating. The right's the cause. Both sides are responsible, but there's just more on the right. There we go. This side's it's just softer. Doesn't have that crunch. The right side's got an actual injury. This is home, where your neck belongs. Yeah, I don't know if, I would say you wouldn't have any scoliosis. This is not a spine that I have scoliosis myself, so kind of know what it looks like. This is, there can be what we call functional scoliosis, where your body, because Ed, I have pain, and then you take an x-ray, and there can be, like I said, I saw your hips were to the right, and your torso's over to the left. Does that make sense? So the body's shifting your weight around, which can make a scoliosis appear, but it's not what I would consider what we call a true scoliosis.
So it does look fine right now.
I don't, like I said, if there is any minimal little lateral deviations, it's because, Ed, I have a disc injury and your body's compensating. Right here. There we go. That allows this to sway a little bit, so we're just going to let this curve a little bit. There we go. And so you were going to have adjustments. Were they talking about stretching at all, or did they give you anything at home to do, or not so much?
Not really.
Okay, all right. Just curious what the standing orders have been. So we have to stretch in order to change posture. The chiropractors originally thought that adjustments can change posture, and as much as I wish this to be true, it doesn't make it true. The only way to restore those curves is the same way they were removed, essentially, by sitting and stretching forward, and so we have to stretch backwards, what we call mirror image stretching. So my job is to loosen you up, and so that when we're stretching, not all the bending just happens where you're injured. And this is how people can get hurt, because if they try to bend back and their lower back's doing all the bending, then ow, you're hurting me. And so we want to first unlock all the other parts. And then when you're flying on the plane, I'm going to show you how you can actually put the Denerol up here, and she'll just, have to sort of live your life knowing, it's like a cavity in a tooth. It would have been better to not have a cavity.
True.
And so is it the end of your life? No. Is it something that we need to manage and understand? Yes. And that's why I'm a little disheartened, because they didn't even tell you that you had a disc injury. It's like, well, they didn't even tell you had a cavity. It's like, so then you keep on chewing on it, or you keep on doing things that continually aggravate the tooth, the disc, the nerve, and so it's...
I was just doing the hot and cold.
Okay.
After he adjusted me,
So the
I
disc...
was supposed to put ice every 20 minutes.
Okay. And this was an ice pack or a bag of peas, or what
It
kind
was
of
an
ice?
ice pack.
Okay. Ice pack is great for skin injuries, for muscle injuries, because they're closer to the surface. When we're trying to reach the disc or the nerve or the joint, we have to use an ice cube to actually get deep enough, because the superficial blood vessels will whisk away the cold and not allow the cold to get deep enough into where the injury is. So an ice pack is not bad at all. Like I said, if your diagnosis was muscular strain, you understand, or you have a cut on your skin, you can use an ice pack. But when we're dealing with a nerve, joint, disc injury, kind of silly. Right, kind of silly to use that. It's not going to reach it. A melting ice cube preferably, so you lay on your right side, you use your left hand to ice cube massage right over those dimples or a little bit above them, right in that lower back, about 10 minutes, 10, 12 minutes. Once it goes numb, take a 20-minute break and then do it again. And that's a great way to harden and stiffen an inflamed disc. And if you think about water, if you heat up water, it swells.
Yeah.
Right? So we want to not put heat on it, so take a hot shower, but don't be standing there for a long period of time with heat hitting your lower back. You don't have to take a cold shower. I just don't want heat for a long period of time on your lower back. You do whatever you want to do, but it's fine. You don't need to be doing that.
No,
well, Dr. Ed said
I do prefer cold showers. I don't like hot showers.
I've been taking cold showers for 20 years, doing exactly what you told me, Dr. Ed. I never said that. I never said that. Who said? I said, no, put heat on that.
But do not take cold showers.
Anyway. I have this guy who window tinted my windshield. It was like a clear tint on my windshield. Love it. It's like reduces a lot of heat coming in my windshield. And it's got these little 3M labels to let you know that it's a quality product. And after he did it, he's like, how do you like it? And I didn't know that it was possible for those little labels to be wiped away. Does that make sense? Because they're kind of in your field of vision when you're driving your car.
Uh-huh.
All these little markers are all over the windshield, little 3M. And I was like,
Sure.
you know, well, I like the tint because it reduces the heat, but it's kind of annoying that I have to drive with all these little labels everywhere. And it had been a few months, and my brothers didn't have any, and I was like, well, maybe, you know, or had less of them or something. And he takes a little alcohol and wipes away the labels, and I was like, if I told you this like 5 years from now, that I've been driving around with these labels in my way and I've been really annoyed, would you have said anything? You wouldn't have said anything, would you? You would have just been like, oh, yeah, it's kind of one of the drawbacks. You see what I'm saying?
Yeah.
I've been taking cold showers 20 years. Yeah, it kind of is annoying, but it's what you got to do with a disc injury. You're not allowed to take any more hot showers. Oh my gosh. Who said that to her? Was it you? Anyway, it's the best analogy. Now my driving experience is much better without having all these little labels in my way. All right, yeah, but yeah, right here. Feel that right there, that knot. I know.
I
There
do
it is.
feel a pain, like
Right there.
and a little bit more up,
Yes,
like underneath
yes.
my shoulder blade. Yeah.
Yes, this is the cause. For the left lower. It actually clicks. Right there, yep. Sorry. That's the cause. So the right middle lockage causes that left lower overstress, but this is where we're gonna get to the root cause and then get this area working for you again, and then you're not gonna feel that left lower back pain, stress, injury. There we go. All right. My goal is to go to the edge and then back off. If I'm going too hard, please let me know. But we do want to, like I said, go
As long as you fix me.
I'll fix you. It's getting you to get off that left side.
Yeah.
You got to get off the left side. You keep chewing on the left side of your mouth kind of idea, and you've worn out all those teeth, and I got to get you chewing on the right side of your mouth. And nobody said anything. Nobody said anything yet. Right there. There it is. And hopefully you can find somebody up north to tell them you found this thing in your middle back. What?
Oh my
Put this nut
God. Oh jeez.
right there. That needs to be removed. Yeah, it doesn't exist over here. Do you feel the
Yeah.
difference? It's smooth.
No, and the left side surprisingly didn't hurt, but the right side does hurt.
The left is already moving. That's why it hurts when you're not here. Does that make sense?
Uh-huh.
This is the abused side. But when I'm working on you, and if I ask the left side to move because it already moves, it doesn't mind me asking it to move more, right? It's the
Yeah.
frozen side that you don't even know exists because it's frozen. When I ask it to move, you're acutely aware of it now.
Yeah.
And I didn't even know that was the problem. And this blockade right here this is what was here. Like I said, I'm going back 10, 15 years.
Oh my gosh.
That's what happened. And nobody checked on it. This should have been resolved 15 years ago.
Well, I didn't have a problem.
Right. It wouldn't happen. You wouldn't have what you're having today. And this is a case of why we should have care at a young age. It'd be a lumbar seated MRI would be ideal, but even any MRI would be able to see it. But they take these laying down MRIs, and because the disc is made of 70-80% water, when you don't, have weight on it, it doesn't look as bad. So, heck, why don't we hang people upside down and invert them and then take MRIs, right? Dr. Ed magically discovered that all disc injuries magically disappear if we just take pictures of people upside down, right? It's like, come on, people. There's no weight on the disc, right? If you have a car with a flat tire and you lift the car in the air, the tire doesn't look so flat.
True.
Right? That doesn't mean the tire's not flat, though. It's just you didn't put any weight on it. So they take these laying down MRIs, and the poor patients are left with, well, my MRIs come back pretty good, but I'm still suffering. Everybody sounds like Kermit the Frog when they have pain. Why do I...
No, that's true. Like a few years ago, I twisted my ankle, and I went to the doctor, and they did an X-ray, and they were like, "Oh, it's not broken." And I was like, "No way!" And I was like, "I know that it's not broken, but I twisted something, and it hurts."
Right. Yeah. We're gonna unlock all this.
That hurts. Oh, jeez.
All right. I mean, yeah, you handled left side pressure easy.
Yeah.
This is all I'm sorry. And that's just local, right? Where I'm pressing, right?
Yeah.
Yeah, we have to, that's what the care has to be centered around is removing
It
this.
was like a knot over there.
Right in there. I got you. Breathe, relax. There you go. Like the Frozen song. Let it go, let it go. Gotta let these guys leave in here. Gotta let them be. Breathe. Let your back relax. There you go. All right. Tickle!
Yeah.
You tickle me.
Oh, I'm super ticklish.
I got you.
I'm so surprised. The left side is like, no pain was there. Like,
A lot less on the left. The side that moves already cleans itself out, so it's the stuck, tight area that builds the most acidity because it's tight. It like traps it inside. And yeah, more goodies over here.
oh my god, yes. There's a huge difference.
Oh my, yeah.
Oh.
I'm sorry, yeah, we gotta try to start ungluing this. Okay. Night and day difference. Right there. There. Usually name these after old boyfriends. Old relationships. Just, oh yeah, here's Teddy. No.
It's hard even to relax it.
Yeah, we're a team here. You have to let that go. I'm just a guide. This is where you have to learn to bend in here again.
Yeah, because lately I'm even afraid to bend.
Mm-hmm. Right, so that's that right side. All of that is where that knot is.
Mm-hmm.
That's right on that right side. That's where we got to get that. We're going to put a dental roll in a minute,
Mm-hmm.
and it's going to emulate my elbow. Can you see all
It
that?
kind of looks like it's
Mhm.
swollen.
It is. It's tight and it's elevated.
Yeah.
All right, breathe. I got you real gentle. Here we go. Exhale. Exhale. Relax your back. Relax. Good. There we go. Breathe. Exhale. Good. We got one. I know. Breathe. Okay. Deep breath in. Exhale.
Oh.
All right. I know. I know.
Ooh.
Yeah. Did good. You okay?
Yeah.
I know. That bone has not moved in a while. Good. Good. Mm-hmm. There you go. It already moved. Mm-hmm. 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 Breathe. All right, it's okay. It's okay. I'm not gonna go too crazy. I know. This too much, okay?
No, that's fine.
Okay, all right, go a
Yeah.
little deeper, okay. How bad is it over here compared to your right?
Oh, it does hurt a little bit more.
Okay. If this was muscular, this would be killing you. You understand?
Yeah.
If this was an attachment, do you understand? You wouldn't let me
Yeah.
do this. This is why we know it's nerve. Whoa, Ed, I'm really tough. No, if this attachment was torn, but there's definitely some swelling in that joint, the joints. These are stabilization muscles of the hip. Yeah, these muscles are overworked over here. But my point I was trying to make earlier is that just working on this won't ever resolve it. We have to take the stress off the lower back. That's the only way that the glute, the leg, will be better. Yeah. Okay, good. Okay. All right. Just press back into my elbow. So press back here. There you go. Good. Yep. Press back on there. Press back here. Here. Good. Nice and loose. Shoulders loose. Can I check your ear? Is that okay?
Yeah.
Okay. Mhm. All right. Go ahead and tilt your head left. Tilt left for me. Tilt your head left. Mhm. Okay. There we go. Go ahead and tilt your head left. So I'm gonna have you just, look straight forward. You're gonna just tilt.
Oh,
That's
okay.
all right, it's okay. There we go. 1 second. All right, go ahead and tilt your head left. Okay. Okay. There we go. Okay, go ahead and tilt to the right. Okay. Okay. It's okay. Go ahead and tilt your head to the right. Okay, it's okay. Come over here. So the disc is made up of two materials. There's a nucleus, a center core, that's wrapped in like blankets or like
Mhm.
wrapping paper called the annulus. And the tears are in the annular fibers that wrap the nucleus. They're actually like fabric that get torn, and then the disc starts to cut through those layers. I don't know if it's a herniation. Herniation means all the layers have been cut through. A bulge means some of those layers have been cut through. The ability to irritate the nerve is the same. The severity is greater when the disc has reached the outside of the outer annulus. It's harder, to try to bring that disc back in. And then even if you do, that pathway has been created like a path through like a wooded area. You've already tread that path, and so it's going to be easy for the disc to just go back out. That's why we have to continually remind your spine how to be curved. What that does is it takes the weight off the disc, and then it's like a donut. If you keep squeezing it, the jelly comes out. By taking the pressure off, everything gets pulled back to where it's supposed to be, away from that nerve, away from the sciatic nerve going down your leg. All right, bring your knees. Let's try to bring your knees left. I know. Is it hurting real bad? Tell me.
A little bit, but not.
Okay.
That's okay.
All right. Hurting where it's pressing, or just is the leg getting worse?
Where it's pressing.
Okay, good. That's okay. If it just hurts where it's pressing, keep working on it. If it's hurting down the leg or in the lower back, let me know, and we could back off and I can adjust things.
Yeah.
But if it's just killing you in here,
Yeah.
thumbs up, and you have to breathe through that and work through that. Sometimes as a way to get relief, you can just take you can do this on your back by putting your hands on your thighs and pushing down, just to open up the lower back a little bit. How does that feel? Does that make it worse?
No, it's better.
Feels better?
Yeah, it feels better.
Just open up that lower back a little bit. Sometimes do it like this.
Sometimes when it hurts a lot, I just put like pressure. Yeah, from the left side, and it feels better. Pretty much like that.
Yeah, this takes the pressure off the joint, opens up the nerve a little bit, but to me, we have to do it on the dental roll because we can't just loosen this without loosening this up and getting your curve back in your spine, which is what's ultimately going to make you not feel the need to even do this. But temporarily, you can do this as a way to get relief when you're suffering. I would try to use ice on the lower back, and like I said, I'll show you in a second with you seated, putting the dental roll in your middle back. You have to sit for pretty much for at least until this thing calms down. Use this as an orthotic to remind you to be curved, right? Not all the time, but start interweaving in your life. It's not good to just let that round. You're in this position for a long period of time, you're going to get up and go, ah, and you're going to want to pop it. Right? So we need to work on, for symptomatic relief, I would ice. Just take an ice cube, lay on your right side, and you ice this. Put your head on the armrest of the couch and just take an ice cube, hold it with a paper towel, and ice cube massage right over that, right in the lower back there, all that area. So this kind of thing is a way to, you're just gripping it. You ever wear something like this before?
Yeah.
You have? I mean, do you have one at home or?
I do, but when I had it like for a long time, and the pain just kept growing.
This is like a Band-Aid. This doesn't get to the root cause. This is just a way to help.
Well, mine is a little bit different. It's like for the whole waist, probably that's why. The pressure, it's in the middle, the back, it's not at the lower back.
Grab, pull that one, this one on top. There you go, and you put that right over that, get the center of that right where you want it. It's just like wrapping an ankle, like people that tape their ankles, you're just creating an external ligament. So the internal ligament that holds that joint together is torn, and you're putting an external ligament on to try to brace it. But if you do that to then go beat yourself up and work more, then you end up continuing to injure it. It's like you have to get to the root cause, which is this is locked, there's no curve in your back, and this just buys you time, or at least stabilizes it so it, meanwhile, so you can survive the time it takes for that to heal and the care required. And the training today was to learn how to not, the wound's still in there. If we took an MRI, we could see it. And the disc wound takes longer to heal than the joint wound. So the local pain usually will calm down faster than the leg. Whenever you have to sit, bring it into restaurants with you. Epsom salt bath would be a great thing to do this evening. If you have the ability to, a couple cups. We're going to the Gulf of Mexico. It's freezing out there, but I don't know, you Marylanders, maybe you can. I wouldn't go in there, but cold.
No. She likes cold showers, so it'll be fine.
All right, well,
I love cold showers, but I hate cold water. Oh, okay.
all right, well, warm bath, warm Epsom salt bath would be what I would do.
Yeah.
Couple cups, soak, and that'll pull the inflammation out of your back, right? So that gives you more space. Again, you'll reduce the desire for you to click because the swelling will go down and you won't feel the desire. To me, that's how this is going to go away. Ed, I no longer feel the desire to click my own spine, and I can't do it even if I wanted to, because your whole spine, by doing that dental roll, you're going to have your middle back working, and you won't be able to isolate your lower back, and that's how you're going to make it to the promised land. All right, you okay? All right, let me hug. Oh, you survived. Okay.
I did.
All right, she can.
Good job.